All right, dentists, you've done the exam, you've taken the x-rays, you've analyzed the situation, and now it's the moment of truth, the treatment plan presentation. What you say, and just as importantly, what you don't say in the next few minutes can make all the difference. It's the difference between a patient feeling confident, understanding exactly what they need, and eagerly saying yes to your recommendations versus a patient who leaves feeling confused, doubtful, and giving you the classic line that I need to talk to my spouse before disappearing from your schedule forever. Saying the right things in the right way is a critical skill that directly impacts your case acceptance, your production, and your ability to really help people. Today, we're going to talk about what not to say during your treatment plan presentation. We'll cover the common communication blunders that sink your case acceptance, and I'll give you a framework for becoming a more confident, clear, and effective communicator. My goal is to help you move from just winging it to developing a proven system that makes your days less stressful, your practice more successful, and your professional life more rewarding. So let's start with the big picture idea. The vast majority of the dentists that I've observed are not too aggressive in their presentations. In fact, it's the opposite. The vast majority are way too wimpy, too vague, and too flimsy when they present the treatment. Only a very, very small minority are guilty of being too salesy or making a couple of minor fillings seem like a life or death situation. So if you're worried about coming across as a used car salesman, chances are you actually have plenty of room to be more direct, more confident, and more clear. Presenting treatment is a learned skill. No dentist is perfect at it from day one. The key is to become a student of your own interactions. Anytime you do an exam and you can just feel that you're not connecting, that the patient doesn't trust you, or that the conversation became awkward, you need to pay attention. After that patient leaves, take a couple minutes and write it down. What did they ask you that threw you off? What did you say that led to that awkwardness? Did you ramble on about the necessity of a crown and end up making it way too confusing? Did they ask a question that you just didn't have a good, concise answer for? You need to learn from these moments. Most dentists just wing it. They have an awkward conversation, presentation, they feel bad about it for a few minutes, and then do the exact same thing with the next patient, repeating this for their entire career. Don't be that dentist. Become a student of communication. Create your own playbook. Pay attention to what works well, what phrases connect with patients, and write those down. Pay attention to what doesn't work, what creates confusion, and find a better way to handle that situation in the future. If you do this before you know it, you will have a confident system for almost any situation that comes up. Now, let's get into the specifics. Here are some of the most common mistakes, the things that you should not be doing or saying. First mistake is drowning them in dental jargon. This is probably the most common blunder. We live and breathe this stuff. So words like occlusal, interproximal, endodontically treated, abutment, or pontics, those are second nature to us. To a patient, it might as well be a foreign language. When we use technical jargon, you're not making yourself sound smarter, you're creating a wall. You're making the patient feel unintelligent and intimidated. And a confused mind almost always says no. So what you should do instead is use simple, clear analogies. A crown isn't a full coverage restoration, it's a strong helmet or a protective cover for a weak tooth. A bridge doesn't have abutments and a pontic, it has anchor teeth and a replacement tooth that fills the gap. Use your intraoral camera. A picture of a cracked tooth is 1,000 times more powerful than you saying mesiolingual fracture. Show, don't just tell, and speak their language. The second mistake is failing to ask what the patient wants first. We often rush right into our clinical findings. Okay, Mrs. Jones, looking at your x-rays, I see you have decay on number 14 and a failing amalgam on 19. We just launch into our diagnosis before we've ever established what the patient's goals are. What you should do instead is start the conversation by just asking them. Before I share what I'm seeing clinically, is there anything specific that's been bothering you? Or is there anything you'd like to change or improve about your smile? This simple question does a few powerful things. It shows that you care about their priorities. It's not just your clinical agenda. It gives them a voice, and often their chief complaint will align perfectly with your clinical findings. It makes the case acceptance a lot more natural instead of a sales pitch. Now, the third mistake is a lack of perceived urgency, or just being too vague. This is where the wimpy presentation comes in. Dentists will often say things like, yeah, you've got a little cavity starting there, or we should probably take care of that at some point, or maybe this tooth might need a crown down the road. This kind of language communicates zero urgency and gives the patient every reason to procrastinate. At some point and down the road translates to never in a patient's mind. What you should do instead is to be clear, direct, and confident about the consequences of inaction without being an alarmist. For example, Mrs. Jones, this crack in your tooth is concerning. Right now, we can protect it with a crown and save the tooth. If we wait, the risk is that the crack spreads and the tooth could break in a way that makes it unfixable, which could lead to needing to remove it and replace it. The best and most predictable time to fix this is right now, while it's still pretty manageable. That communicates urgency based on clinical reality, not high-pressure sales. Now, the fourth mistake is just not addressing the finances at all. You're just ignoring the elephant in the room, especially for big treatment. Many dentists feel uncomfortable talking about money, so they present the clinical treatment and then quickly exit the room, leaving the financial discussion entirely to their staff. This can create a major disconnect and often leads to patients feeling ambushed at the front desk. What you should do instead is that you, the doctor, should at least open the door to the financial conversation. You don't have to discuss every detail, but you should confidently transition them. After presenting the treatment, you can say, now, I know that cost is an important part of every decision, so what I'm gonna have you do is, I'm gonna have you next to meet with Sarah, our treatment coordinator. She is fantastic, and she's gonna go over all the numbers with you, look at the insurance benefits that you may have, and discuss all the different payment options available to help make this work for you. This shows that you're aware of the financial reality and provides a smooth professional handoff. If you have lots of different options, don't be afraid to ask the patient if they've been saving up for this or if they have any financial limitations or limits that you should consider when creating a plan for. Now, the fifth mistake is giving your staff too big of a role in closing. Following on the last point, while your team is essential for financial arrangements, they should not be responsible for explaining the clinical why behind the treatment. If a patient gets to the front desk and starts asking your treatment coordinator, so why do I need a crown again? Or is this really necessary? You have failed in the operatory. What you should do is ensure clinical clarity and patient buy-in before they leave your chair. Your team's role is to handle the how, the scheduling and the payment. Your role is to establish the why, the clinical necessity and the value of the treatment. If your staff is constantly having to re-explain the treatment, it's a sign that your presentations need a lot of work. Now, the sixth mistake is a lack of clear direction for the patient's next step. You finish a great presentation, the patient seems to agree, and then you say, okay, great, well, give us a call when you're ready to schedule. This is a recipe for complete inaction. You've left the ball entirely in their court and life will get in the way. So what you should do instead is always end with a clear, specific call to action. Guide them to the next logical step. Excellent. The best next step is to get you scheduled for that first appointment. I'm going to have Sarah walk you up to the front and then she'll find a time that works well for you. This simple directive removes ambiguity and moves the process forward. And finally, the overarching mistake that encompasses all of these is a lack of confidence. If you don't seem 100% confident in the treatment plan that you're recommending, how can you possibly expect your patient to be? If your voice wavers, if you seem uncertain, if you present multiple options without a clear recommendation, you are definitely projecting doubt. Patients can sense this from a mile away. So what you should do, and this kind of goes back to my first point, is become a student of this entire process. Practice your scripts, know your why, use visuals like intraoral photos to boost your own confidence and the patient's understanding. Then thoroughly plan your cases beforehand so when you walk into the room, you'll have absolute certainty about what needs to be done. Your confidence is contagious. Improving your treatment plan presentations is one of the highest return activities that you can do. It leads to higher case acceptance, which means more production, and it means you get to do more of the dentistry that your patients actually need to be healthy. It reduces misunderstandings, it builds trust, and makes your days smoother and more fulfilling. So if you're ready to stop winging it and then start mastering these critical skills, I encourage you to take these points to heart. If you want more practical strategies like this and how to build a better practice, make sure you hit that subscribe button. Let's keep working together to make dentistry more fun, fulfilling, and rewarding. Subscribe so you don't miss the next strategy, and I'll see you soon.